The cat's out of the bag about mail order pharmacies owned by pharmacy benefit managers. You've probably been told by your insurance company you need to fill your certain prescriptions by mail order, and there's a reason for that. First, watch this little 1 minute video from a pharmacist in Fort Worth, Texas, and he'll explain to you how this
How would
works.
you like to pay $13,000 for a medication that costs $36? Well, a couple of insurance companies thought that sounded just right to them. So I got my hands on some reimbursement from a pharmacy. Normally when I talk about the prices, I'm talking about what the insurance payer is paying, like the government or your employer. In this case, I'm talking about what made it all the way to the pharmacy. So in this case, the drug was metformin ER, and the pharmacy paid $36 for this medication, and then they were reimbursed from one insurance company for over $9,000 for that medication, and then it was billed to a secondary insurance for nearly $4,000. So this pharmacy made $13,000 on just one prescription out of nowhere. And where did that number come from? Who knows? The PBM just decided to bill that much and send it on over. Makes no sense. Hooray! $13,000 for metformin ER that costs $36. Great job. Anyway, if you don't want to get ripped off, go to forestparkpharmacy.com, look at the price checker, see those fair and transparent prices so that we're not getting ripped off. All right.
Last week, the Wall Street Journal published an in-depth article looking at the rising cost of mail-order pharmacy prescription fulfillment. Several years ago, mail-order pharmacies were created supposedly to save drug costs for consumers and their employers. However, they are doing the opposite. This is especially true for mail-order pharmacies owned by the pharmacy benefit managers. So you've probably heard of Caremark, Optum RX, and Express Scripts, the three biggest that are owned by insurance companies. On average, generic drugs are marked up 3 times higher than where you could get them at a bricks and mortar pharmacy. Branded drugs dispensed by mail are about 3 to 6 times higher than what you could get at a grocery store pharmacy, and marked up 35 times higher than what you could get at an independent pharmacy. The article looked at an independent nonprofit clinic called Unicity Care NW in Washington State. And even though only 10% of their prescriptions were filled by mail order pharmacies in the first 3 months of 2024, that accounted for 81% of the clinic's prescription drug spending. I looked at one drug, clobetasol propionate, which is a topical steroid cream, and through a retail pharmacy, the profit margin was less than $50 on that prescription, but through a mail order pharmacy, the profit was about $4,800. The Wall Street Journal asked to interview their PBM manager, and they declined with concern about legal liability for discussing its drug benefits. Wonder why. So be careful when you're told you need to order your prescriptions by mail. Your mailbox is probably filling up with bills, and going out your mailbox is money. Have a great day, and I'll talk to you later. Bye.